You can only imagine what I went through in terms of pain and what it's like on a daily basis.
Wendy Perkins suffered from a huge fibroid tumor of the uterus. Uterine fibroids are non-cancerous tumors that affect 25% of women. Surgically removing the uterus is the most common treatment, some 200,000 annual procedures.
With each doctor that I went to, and I saw 8, with each one, except for the last, they only wanted one thing for me, and that was hysterectomy.
That last physician was Dr. SUZANNE LEBLANG.
In October of 2004, the FDA approved this technology to be used for uterine fibroids. So we actually performed the first case the day after FDA approval, and it was so exciting.
3 years later, Wendy decided to go with ultrasound. This is where it all happens. In conjunction with the images from a standard MRI machine, the patient lies down, her abdomen is there, and the ultrasound beams come up from there and do the surgery. Dr. Joy Polifrone describes how those beams work.
They're focused to a point, and only at that point where they're focused will they have an impact. It's just like someone would take a magnifying glass and use the magnifying glass to focus the light of the sun.
Now with 160 of those surgeries performed, LeBlanc says the procedure is like the ultimate video game, thousands of clicks per surgery. But the results are very real for LeBlanc's current patient, Robin. She's inside the MRI monitor with the ultrasound device below her. LeBlanc directs the entire process from an outer control room. The dark area is one of the fibroids, while she makes preliminary adjustments to the beams.
We went up much higher on the energies, so this one should be getting more therapeutic dose now that we know we're getting where we want it to go. We know the machine's calibrated right.
Then she fires away, blast after tiny blast.
This is the beam path going in, and this is the beam path going out.
The results? The blue spots are already done, the green circles are future targets, and
the red ones, I have to angle the beam differently because right now it's overlapping one of those intestine areas that we talked about, so that's telling me I can't do it right now.
LeBlanc carefully monitors each hit on Robin's 4 uterine tumors. She proceeds bit by bit until the tumors are burned out. We followed Robin through her surgery as she walked to recovery on her own. 15 minutes later, she spoke to us.
I'm ready to go. Just a little groggy, but that's because I had a little bit of anesthesia. But that's about it.
But you were awake during the whole time, and obviously we heard you talking back and forth.
Yes, yes. And it was great. It went very well.
Robin's now back home, expecting the final results patients like Wendy have seen.
It took about maybe a month, perhaps 2, for it to really become completely invisible.
And LeBlanc says side effects, such as minor burns in adjoining healthy tissue, are extremely rare, especially as doctors perfect the procedure even further. What does this cost, and who pays? Despite that 2004 approval, insurance companies aren't paying. Patients can expect to pay more than $10,000 out of pocket.
It's very hard to do the typical research that our insurance companies want to see. We're broaching on a whole new world now, going from invasive procedures and invasive surgeries to minimally invasive surgery to non-invasive surgery, and there's no standard to compare it to.
Neurosurgeon Dr. Neil Cassell is helping lead the effort to gain that insurance coverage and to have the surgery used for more than just fibroid tumors.
To treat a whole variety of benign and malignant tumors, to treat stroke and Parkinson's disease, heart disease, atrial fibrillation.
Cassell is also working on ways to use ultrasound for a wide variety of brain tumors and diseases without a knife. The procedure also has great promise for controlling breast, prostate, and other cancers.
We view it as a disease that has to be maintained and monitored in treatment. So a chronic disease instead of a fatal disease.
One potential heart application is to zap life-threatening clots blocking blood vessels. Another possibility? Using the ultrasound beams to pinpoint and release injected medicine right where it's needed to fight tumors or promote healing. The rest of the body remains free of side effects. With so much promise, Cassell, Polifrone, and hundreds of others are working to put ultrasound treatments out there as quickly as possible.
Absolutely. Our goal is to compress the technological development time so that the impact on lives is far greater.
Multiplied millions would be able to go back to enjoying their lives. Gailon Totheroh, CBN News.